and inviting the World Food Programme Caribbean to share our experiences. While this might not be the typical humanitarian context being discussed throughout the forum, there are some very interesting aspects that transcend the Caribbean and can inform shock-responsive social protection globally. So I'd like to quickly set the stage before passing it over for the panel discussion. Next slide, please. So as a region of small island developing states, the Caribbean is one of the most vulnerable to climate-related disasters and other shocks. The Caribbean is ranked as the second most hazard-prone region in the world, and between 1970 and 2016, the region suffered over US $22 billion in damages as a direct result of disasters. On average, disasters affect 10% of the population of SIDS, compared to just 1% in large states. It's a region that's also highly vulnerable to economic shocks, and countries experience high levels of indebtedness. The Caribbean has had a strong history of using social protection systems to meet the needs of the poor and vulnerable people. And there are experiences using social protection programs and the systems to support people in situations of disasters and financial shocks going back nearly 2 decades. COVID-19 vastly increased and accelerated these experiences, with all governments across the region turning to social protection as an important tool to address the socioeconomic impacts of the pandemic on the population. Guided by its 2022 to 2026 multi-country strategic plan, WFP works with national, sub-regional, and international partners to strengthen the resilience to climate change and other risks. WFP's support to the English and Dutch-speaking Caribbean has a strong focus on capacity strengthening, with investments in research and advocacy, the digitalization of systems, assets and infrastructure, and human resource development. One of the key areas of WFP's work has been to work alongside with governments, providing tailored technical assistance to enhance national social protection systems to better respond to the needs of the most affected persons in times of crises. Next slide, please. Now, strengthening social protection systems and preparing them to be more responsive is critical. For WFP, there's 6 key entry points for doing so: strong institutional arrangements, effective information management and data systems, relevant targeting mechanisms, efficient delivery mechanisms, good coordination between relevant actors, and adequate financing. And I think it's this emphasis on investing in preparedness of these systems which has made the work of the World Food Programme in the Caribbean quite different. Next, please. Now, WFP's had a strong research and advocacy agenda in the Caribbean. Since 2018, WFP has completed numerous case studies in the countries in the Caribbean and have documented the use of social protection in response to crises and makes recommendations on how systems can be further improved. This research, coupled with the experiences of WFP and others, have helped to shape a training package in shock responsive social protection for the Caribbean. Now, data is critical for shock responsive social protection, and WFP has supported governments with monitoring cash transfers through social protection and also with visualizing assessment data through various dashboards. Next, please. COVID-19, as I mentioned, has been really a tremendous opportunity to strengthen social protection systems whilst delivering critical cash, food, and voucher assistance programs. In partnership with WFP, governments in Jamaica, St. Lucia, Dominica, and St. Vincent, amongst others, have been able to innovate and test out new digital solutions to transform previously manual processes related to registration, vulnerability assessment, how cash assistance is distributed, monitored, and reconciled. An exciting development has been an innovative pilot that links climate risk insurance through the CRIF SPC, which is a first of its kind parametric insurance facility targeting governments. And that's been tailored to the national social protection system in the Commonwealth of Dominica. And we've partnered with the government to top up its premium. And so that once triggered, any payout that might come, the same proportion will go towards the immediate delivery of cash assistance to those most impacted. Of note is the fact that these investments have had multiplier effects, facilitated by strategic partnerships like those with the World Bank, WFP, and national governments. This has led to the expansion of public assistance program in St. Lucia, the extension of the timing of support to persons affected by the La Soufriere volcanic eruption in St. Vincent and the Grenadines, and opportunities for governments to be more innovative and for greater sustainability of these investments as they're tested and further refined by governments themselves. And WFP is really honored to host this session on shock responsive social protection, sharing the insights and lessons from those responsible for implementing these innovative programs in Dominica and Jamaica. And WFP also welcomes the participation of the World Bank, an important partner in ensuring the sustainability of these investments. Finally, the Caribbean in many ways acts as an incubator for innovation. The lessons coming out of these experiences are relevant to other small island developing states and to governments and humanitarian partners that seek to bridge the humanitarian development divide globally. So I'd like to, on that note, pass the floor over to Lola Castro, who will facilitate the panel discussion. Thank you.
Thank you very much, Regis, and for this very good introduction to the Caribbean and the challenges and the opportunities. And today, in our European Humanitarian Forum session on shock responsive social protection, we're going to hear the lessons from the Caribbean from three prominent panelists. And let me present them to you before we start the discussions. First, I would like to present you Mrs. Colette Roberts Risden, who is the Permanent Secretary of the Ministry of Labor and Social Security of Jamaica since 2015. Welcome, Mrs. Robert Risden. She has joined the public service in Jamaica in 1993, and since then she has served in the Statistical Institute of Jamaica, the Management Institute for National Development, and the Office of the Prime Minister. She has also spearheaded the design and implementation of the Program of Advancement through Health and Education, named PATH, Jamaica's premier social protection program. And her main area of specialization has been social development and research. Welcome today to our panel. Let me go for our second panelist, prominent panelist, Mrs. Sylvain Barton, who presently welcome Mrs. Sylvain Barton, who presently serves as the Permanent Secretary in the Ministry of Youth Development and Empowerment of Dominica. She has previously worked as Permanent Secretary in the Ministry of Social Services, Community Development and Gender Affairs, the Ministry of Kalinago Affairs, the Ministry of Foreign and CARICOM Affairs, and the Ministry of Trade, Energy and Employment. And Mrs. Barton was also a member of the Carifuna Cultural Group, the oldest cultural group in the Kalinago territory, reviving and assisting with the preservation of the cultural heritage of the Kalinago people. Welcome again. And our third panelist, Mr. Clemente Avila, is a social protection economist. Welcome, Clemente, at the World Bank, with extensive experience working in Latin America and the Caribbean. And his focus is mostly on social protection and labor systems, including adaptive social protection, safety nets, public employment services, and evaluation. He also has experience conducting independent research and coordinating research teams. Prior to joining the World Bank, he has worked as Deputy Director of Evaluation at Mexico's National Council for the Evaluation of Social Development Policy, well known as Coneval. So welcome to the three of you to this panel, and we want to start our discussion. And as we have heard, Regis has set the scene very well on the Caribbean, and I'm going to ask you a number of questions, and really will appreciate that you give us all your insights. Let me start saying that for most governments, social protection is a cornerstone of national policies that addresses poverty and food insecurity. And this is through interventions that help people meet their essential needs and manage the risk they face through their lives. In this light, let's try to go around with you with your first thoughts. And if possible, if you can do it in 3 minutes, I'm going to ask the three of you. The first question we have today for our esteemed audience as well is to all of you, and I will call on you, each one of you first. Why is social protection such an important tool for emergency response in the Caribbean? And let me start with Mrs. Colette Robert Risden, if you can reply to this question. Thank you very much.
Okay, thank you. And morning, everyone. Morning, Regis, Lola. Good to be here this morning. You know, the Caribbean, as was outlined earlier, is highly vulnerable to numerous disasters. And social protection systems over the years have been used as a primary strategy for governments within our region to leverage the kind of support that is needed for our vulnerable population. If I must take you back to a practical example, back in 1988, many of you will recall Hurricane Gilbert, a very devastating hurricane in the region. And I use that as an example because back then, our social protection systems weren't as developed as they are now. And so, you know, you had that particular hurricane, and after the event, we were all scrambling to see who should be assisted, how can we assist them, what is needed, and so forth. And so within the region, specifically, our social protection programs have been used to support people impacted by the disasters. Why is it important? Our systems, our programs allow us to identify where our vulnerable groups are located, who they are, so that either before an event or after an event, we're in a better position to respond quickly to support their needs. I use Hurricane Gilbert as an example. I was a young adult at the time, and I remember it took maybe about a year for us to get electricity. And you can just imagine the ripple effect of that in the economy and on other persons. But bringing it closer home, so in Jamaica, for example, we have used our social protection systems to pivot to a new dimension of shock responsive and adaptive social protection. So in Jamaica, the PATH program, as early as 2007, the PATH program was expanded vertically in the aftermath of Hurricane Dean in order to reach our vulnerable groups. And we know who the vulnerable groups are on PATH. For some of you who don't know, PATH targets primarily poor families comprised of rural, mainly rural families, families with lots of young children, the elderly, persons with disabilities. And so we were able to expand the program vertically to reach this group. More recently, with COVID, of course, we've continually used the program as a good, should I say catch, for want of a better terminology, of persons who are deemed vulnerable. So in 2020, 2021, as recently as in December of 2021, the PATH program has been used to provide support to our vulnerable population arising from the impact of COVID. So why are social protection systems so important as a tool for emergency response? If I can sum it up and close right here, Lola, social protection systems give us a base or a platform that we can use to support vulnerable groups impacted by hazards. And there are weaknesses to that, but I think I will save that for later down in our conversation. Thank you.
Thank you very much, Colette. Excellent points. And let me pass to our colleague from Dominica, Mrs. Barton, to reply her question briefly. And as you well said, Colette, we are going to develop more details, and you will tell us more about PATH and others. Mrs. Barton, over to you.
Thank you, Lola. A pleasant good morning to all our panelists, and of course, good morning to Regis again. Social protection is increasingly being considered as an effective policy-level intervention for reducing vulnerability, poverty, and for contributing to the development and structural transformation of our societies in the Caribbean. It is a critical tool as more and more we feel the worst impact of climate change on our small island states. Our economies are small and very vulnerable to shocks. The impact on our GDP can be humongous. And I want to use the example of Dominica, where in 2015, 10 to 12 hours of rainfall called Tropical Storm Erica affected 95% of our GDP. and resulted in government having to relocate at least 3 of our most vulnerable communities. This involved the acquisition of suitable land and construction of over 500 homes to have the families relocated. We are presently working on the relocation of the 4th community which was affected. This involves the moving of or the resettlement of 149 families. And again, we were severely affected by Category 5 Hurricane Maria in 2017, when 226% of our GDP was washed away. Every sector of our society suffered from these climatic conditions, and so social protection became a very critical tool in responding to these emergencies, in providing the basic needs of food, shelter, water, and other such needs to everybody in the country. After Hurricane Maria, every human being who lived in Dominica was affected. And to add to that, the COVID-19 pandemic has only compounded the situation because we were just recovering from this humongous storm. Its impact is having far-reaching impacts on the recovery for all our citizens and, of course, the GDP of our country. We continue to see that the lives and the livelihoods of an entire population can be shattered in a matter of hours. The entire Caribbean basin is at risk of being affected. Our small islands are susceptible to many shocks. A number of our countries have active volcanoes, as was mentioned by Regis. We experienced that in St. Vincent. And my island, Dominica, my island home, Dominica, we sit on 9 volcanoes. It is therefore critical that we use the social protection tools that we continue to implement with our partners in preparation for these real emergencies. And we will develop this discussion as we move forward. Thank you.
Thank you very much, Sylvain, and very good points on the situation of Dominica. Thanks for letting us know how you use social protection. Let's go to Clemente Avila. Mr. Avila, please, can you give us your first thoughts before we continue?
Thank you very much, and good morning to everyone. It's a pleasure to be with you on this panel. So I'll try to keep my answer short. So I think it is well known that shocks can have long-lasting consequences on multiple human development outcomes, including nutrition and health outcomes, education, and it can also affect, of course, labor market outcomes. These are usually the consequence or are exacerbated by the negative coping strategies that families need to take when they are facing these disasters. So they usually tend to skip meals. They can reduce their food consumption to unhealthy levels, and we are particularly worried about certain vulnerable groups, pregnant and lactating women, families with children, the elderly, etc. Just to mention a few. Families may decide to take children out of school if they require more help to make ends meet, to help on the family farm or to send them to work. Or families can decide to sell productive assets. So all of these can have long-term implications on their well-being and not just on the immediate after the shock. We also are well aware that shocks affect disproportionately the poor and the vulnerable, and we are particularly worried about them. And social protection, it is so important during the emergency response because it is one of the most effective mechanisms to protect families from taking this type of actions. It can help to solve the immediate needs, but it can also help the families to build resilience before the shocks even strikes, before the disaster happens. So it has been well documented that families that have been receiving, for instance, cash transfers before a disaster are better able to cope with the crisis and the effects are less extensive. No? So I think this is very important, and even more so in a region like the Caribbean, which is very prone to disasters and crises. Thank you.
Thank you, Clemente, and very good points that you bring us from the knowledge from the World Bank. Let's pass to the second question, and this one will be directed to Mrs. Robert Reinders and Mrs. Barton. And we know that Dominica and Jamaica, and we have heard from you from the first question, have had a history of establishing social protection systems, and in particular programs that help to respond to various types of generalized shocks. You all mentioned some of the hurricanes and disasters that occur in your islands from hurricanes, but now recently also the COVID-19 outbreak. And so there are three questions in this one, and we would like to hear what do you see as the top 3 successes and challenges arising from the use of social protection systems in these emergency responses? That will be the first one. The second one will be, what have these experiences been like? Share with us a little bit your experience as you did before. And how has government had to shape social protection systems across the varying scenarios? There have been different types of shocks. So how have you done that? So let me start this time with Mrs. Barton. And please go ahead, Mrs. Barton. You're on mute.
Thank you, Lola. Dominica has had a history with emergencies, and we have established a number of social protection programs aimed at responding to these shocks. These programs include cash transfer programs, distribution of food, agricultural produce, and also assistance to farmers. In the cash transfer program, we worked with some of our external partners, and in particular, we have worked very well with the World Food Program, where we conducted rapid assessments and registration of the most vulnerable. This is added to the list of already existing vulnerable families. Verification of those registered is done, and cash is provided to these families within a short time frame to assist these vulnerable families in providing for the immediate needs of their families. A top-up was also provided to the cash grant already being received by families who are listed in the government monthly cash assistance program. Packaged food supplies were provided especially to the elderly and housebound. Startup grants were provided again with the help of our international partners like the World Bank to farmers, both small and large, to urgently get back to production of food supplies. We observed that during the COVID pandemic, government also provided seeds and plants to every family in Dominica. Families who did not occupy land spaces were encouraged to use old fridges, for example, and other utensils that were discarded to fill them with soil and to plant vegetables and other crops that they use. They really utilized creative means in doing that. Additionally, during the pandemic, the World Food Program assisted with the cash transfer program aimed at cushioning the effects of the pandemic on the most vulnerable families. During that period, we had a pilot program implemented to have all payment reconciliations done digitally. We look forward to the future where all payments will be done via direct payments and through digital reconciliation. This greatly assisted us with reporting and ensuring that the cash transfer program reached its intended beneficiaries. Thank you.
Thank you very much. Excellent experiences. Let's go to Jamaica with Mrs. Robert Risden, please.
Okay, thank you. You know, Jamaica is located in the second most vulnerable region in the world to natural hazards. And in 2011, the UN ranked Jamaica as the country in the Latin America and Caribbean region, the second highest level of economic risk exposure to 2 or more hazards. And, you know, in Jamaica, we, because of course, the natural risk that we experience, we use a multi-sectoral approach to disaster management. The response effort invariably involves a tripartite set of entities or actors that involve the public sector, government, the private sector, and civil society. Our social protection systems respond to and mitigate against shocks. Over the years, various social protection programs have been extended using a combination of different approaches, as I had mentioned earlier: horizontal, expansion, vertical, piggybacking, and alignment. For us in Jamaica, just to give you some examples of what we've done, the PATH program and our social insurance program, namely the National Insurance Scheme, both were expanded vertically on 2 occasions to respond to natural disasters. These programs reach persons that are mutually exclusive: the national insurance or elderly population, and of course, the PATH program, as I mentioned earlier, that reaches the elderly who are not in receipt of a pension, persons with disabilities, and other poor families. So we have used those programs. Now, based on the large-scale impact of the events and the fact that the ministry hosts these 2 major systems, as I said before, it was used to leverage those databases to provide support. In more recent times, the social protection system has been extended to respond to the COVID-19 pandemic. These same list of persons were used to distribute care packages early in the pandemic, of course, when globally we were all locked down and thought that, you know, if we locked down and closed our borders for a short period, then the pandemic would go away. But of course, that didn't happen. And so early in the pandemic, recognizing the vulnerability of these groups, we were able to utilize these databases to provide support to households in quarantine and other vulnerable groups. We partnered with the World Food Program, and I should put a plug here to thank the World Food Program for their support to Jamaica over the last couple of years to also assist persons with food packages and other assistance. Our CCT program, PATH, we used it to provide additional payments to families, recognizing that many of these families are either unemployed or underemployed. So in terms of the cash support, in terms of economic support, the government was able to provide additional support to these persons. Schools were not in session, and so children under these social programs within school would receive school feeding. But because school was not in session, we were then able to use the program to provide additional support to the families in lieu of having received lunches in school. And of course, we have other groups that we provided assistance to. So what has the experience been with some of these initiatives that we've used? And I'm speaking about the social protection initiatives that were undertaken in Jamaica. There are other initiatives that were undertaken by the Ministry of Finance, more geared towards the financial and productive sectors. But what has the experience been? Expanding, on the positive side, expanding our social protection system was quick and it was an effective mechanism. What was the downside? The downside was that it was not precise. And so in Jamaica, of course, we're a developing country. We do not have all the resources that are needed to provide support to everyone. And so we have a history of targeting, meaning targeting the most vulnerable. However, the kind of expansion we did, we were not necessarily the most precise in terms of the most vulnerable. So as I mentioned before, in terms of our target groups, we know you have some who are unemployed or underemployed, but then there's some who are employed and their sectors within which they're employed were not impacted. But because of how the system was used to leverage to provide support, everyone got that support. So that was the downside to it. Positive, we were able to respond quickly. Another experience is that we need to establish systems and processes to facilitate flexibility and horizontal expansion. Manual distribution was cumbersome, as was done in the early days of the pandemic, distributing actual physical care packages to households in quarantine. It was cumbersome and it highlighted the need for a more developed logistics system. There is need for an established database for all the vulnerable persons or persons on the fringes of vulnerability to facilitate quick horizontal expansion. And I must admit, Clemente, I was a skeptic initially of a social registry, but our recent experience in the last 2 years with the COVID pandemic, I am now saying we definitely need that social registry. It was cost effective in that it did not require large financial outlay to conduct assessments and verification, because we had, as I said earlier, we had a platform of persons in need and based on their vulnerability to work with. The persons who were not affected, we could not necessarily reach them with the response. You know, we couldn't reach some persons because they were not within our network of persons pre-identified for assistance. We risk the exclusion of affected persons, therefore, and needy persons who are not, as I said before, in our programs. There was no opportunity for us to differentiate payments or the level of support that was provided to families or persons in need based on the degree or the level of impact that they suffered. And of course, there was no guarantee that the amounts paid will be used by the individuals to support their recovery expenses. But overall, what I would say is that what we did in Jamaica and the experience was certainly a positive experience. Some of the lessons learned has pointed us in directions where we need to strengthen our system so that, you know, if we have either another natural hazard affecting us or a pandemic like what we have experienced in the past few years, we will certainly be in a better position to respond, certainly based on some of the lessons that we have learned and the experiences. Thank you.
Thank you very much to both of you for those very detailed experiences, achievements, and challenges. And let's continue then. And what we have seen in the past 2 years, we have seen that social protection was a favored response by governments. We have heard the governments of Dominica and Jamaica, how they have used them, especially with the socioeconomic impact of the COVID-19 pandemic. And according to your latest statistics from the World Bank, there are the estimations that 223 countries and territories have implemented over 3,800 social protection measures worldwide, costing an average of 2% of the country's national GDP and ranging more or less from about 1.3% in low-income countries to 2.5% in high-income country setting. So in this context, I'm going to make you now a question, Clemente, and for the World Bank, and to see if you can reply to us also and contribute to this very good dialogue. The question, small island development states like those in the English-speaking Caribbean that we have heard from are some of the most vulnerable to climate change, and they are really having wide encompassing socioeconomic consequences. In the face of COVID-19 pandemic, we have seen that the governments, we have heard, were simultaneously deploying humanitarian responses while seeking to build also and strengthen the long-term resilience, which is extremely important. And we would like to ask you, what is the World Bank's role in supporting the governments to make a social protection system more responsive to these complex environments of risk and shocks? And how does it work with other partners to ensure the progressive adaptation and flexibility of these national systems over the time? So over to you, Clemente, and we would like to hear from the World Bank now.
Thank you so much, Lola. So, so the World Bank has a long history of supporting social protection and labor systems in the Caribbean, no? Even before the pandemic. The pandemic, of course, brought social protection to the center and underscore its importance, no? If it was, if there was any doubt. So the bank has been working very closely with governments and partners on strengthening the foundations of social protection systems, on modernizing such systems, but also on moving towards an adaptive social protection system and advancing this agenda. No, so the bank has been providing technical and financial support, working on the building blocks of adaptive social protection. And some of the main elements of these building blocks were already mentioned in Regis' presentation during the opening on the session. And I think we have been covering all those areas. No, so we have been providing support in response to the emergency in most of the Caribbean countries. So during the pandemics, of course, countries were trying to see how they could support workers and households during this emergency. No, so the bank has provided financial support for the reforms that were implemented right after the outbreak. No, but we have also been working in supporting more medium-term reforms. No, where what we're trying to do is to modernize the systems and be better prepared for the next shocks, basically. No, so here we have been working on the agenda of social information systems, no, on improving social registries, on building better beneficiary registries, on improving targeting, on helping countries modernize basically their referral systems and case management, among many others. No, so I'd like to highlight that the World Bank collaborates very closely, and not only with the governments, of course, which are the ones that are leading these reforms and these agendas, but also with the broad range of development partners. Now, of course, including WFP, but we also work with the other UN agencies and other international financial institutions such as CDB, no, which is very, very important in this region. No. One of the examples that I like to highlight when we talked about the specifics of the collaboration is our work in St. Lucia, because I think it brings a lot of the elements that we would like to see in all of the countries. No, so we have been collaborating under strong government leadership, and for instance, during the pandemic, WFP, as you know, provided a grant to be able to expand their cash transfer program, and the bank came in to provide additional financial support to ensure that this coverage expansion could be sustained over the medium term. So I think this is one way where we have seen two partners working closely together and providing much needed help to these countries. No, also on the technical side, for instance, also in St. Lucia, we are currently supporting an update to the National Social Protection Policy. No, and in here, we have been going around making consultations with all the development partners to ensure that the findings of their technical assistance are considered and included or incorporated as appropriate under the leadership of the government, of course. No, so I think these examples are very specific, but are also what we consider good practices. No, and we would like to see these in other places. We have started a similar collaboration now in Jamaica. So we're very happy to be working with WFP, but also, of course, with the other members under the leadership of the ministry that Ms. Colette Roberts-Risden is leading. Thank you so much.
Thank you very much, Clemente, and really good to add additional examples, and also those examples of collaboration between all actors, governments, World Bank, WFP, and other UN agencies as well, and the other IFIs, as you mentioned, the CDB. Thank you for that, and let's continue. We're getting a lot of insights here, and obviously it is very important that with the annual expenditure of trillions of dollars that national protection systems operate at a scale and magnitude that far exceeds any international humanitarian response. So we have heard that it's very large social protection schemes. And to this end, it's extremely important, and we have already heard the three of you talk about innovation that has been proven a critical enabler to enhance governments' outreach and quality of social protection support. So let's talk about innovation a bit more with our colleagues from the governments of Jamaica and Dominica. And we have heard you have embraced technology and innovation to digitalize various processes. You also say you would like to do more and to improve, you have been doing that to improve the provision of social protection to those most affected in a crisis. And we'd like to hear now from your experience, what have been the most important lessons learned in the process of embracing digital solutions to strengthen your national protection systems? So if you can focus on that, it will be great. Let's start now with Mrs. Colette Roberts-Risden, and we continue with Mrs. Barton. Please, Colette, over to you.
Okay, thank you. Thank you very much. What has been our experience? Well, first, let me say, before the pandemic, and the pandemic was the last 2 years. For example, for our PATH program, our payments to our beneficiaries was pretty manual. And so what our experience over the last 2 years has forced us to do, we always knew we needed to have greater financial inclusion and to utilize more digital or electronic means of providing support to our population. But there was a kind of reluctance or apathy towards moving more aggressively towards these systems and so forth. So over the last 2 years, one of the positives out of the pandemic is that it has forced us, where we were a little reluctant or hesitant before, it has forced us to push even harder towards financial inclusion and to moving our payments or support to our target groups utilizing more digital or electronic. So pre-COVID, 15% of our PATH beneficiaries used to get their payment using electronic methods. Now, as of February, it was 40%. Our national insurance scheme, it used to be 20%. Now it's close to 70% of our target group receiving payments electronically. It has also forced us to digitalize our data capture methods in the field, the use of more electronic devices to collect information on persons who we are serving or who have received support from us. We've been able to pilot the Jamaica Household Disaster Impact Needs Assessment application form and put it into use. That form used to be manually collected out in the field. They would come in and we would have an army of data entry persons entering information into the database. Now the information is collected using tablets right there out in the field on the persons who we are providing support to. So what have some of the lessons learned been? There's relatively low digital adaptation by some vulnerable groups. So try as hard as we might, provide support as much as we can, there is still a low level of digital adaptation by some groups. And we find this primarily among our elderly group, for example. There is low financial inclusion rates. And so while we were pushing for our target group to open bank accounts and receive the support from government in their bank accounts, we were fighting against banks that were raising the cost of doing business with them, the banking fees, and many of them closing the physical location. And we still have a society that is heavily cash-based, and there's a preference for cash. I can see the physical cash in my hands, I can feel it. And, a lot of our target groups who we support want that physical cash in their hands. Many of our clients do not possess adequate resources to facilitate the use of digital payments to them. Many of these payment methods require the use of smartphones or internet or data plans on their phones. As well as there is inadequate ecosystem. I mentioned earlier we were fighting against banks increasing their fees and shuttering their physical branches. And so, the ecosystem was either not there or declining. The critical nature of communication with and the engagement of our beneficiaries. How do we be more precise? How can we get communication out to our target groups in clear, easily understood formats? Those were some of the lessons learned from our digital expansion. One of the biggest benefits, though, is the ease from an administrative standpoint, how easier administratively things can become if we utilize more digital or electronic methods of the way we work. Thank you.
Thank you very much for those very good insights. And let me go rapidly with Mrs. Barton and finish this question, because I'm sure Dominica has a lot to contribute as well on digitalization and innovation. Over to you, Mrs. Barton.
Thank you, Lola. The government of Dominica has embraced the use of technology to digitalize some of the processes as we seek to improve the delivery of support to those affected or the most vulnerable in times of crisis. The digitalization of registration of beneficiaries is one such instance. And again, we want to thank the World Program who assisted us, World Food Program who assisted us with the training, the technology, and provision of the equipment that was required to have registration of beneficiaries done within a short period of time. The enumerators were provided with electronic handsets. They were trained in the use of the technology, and they were provided with the support to go into the communities and have the registrations done within a short space of time. As the registration was completed, the information was uploaded electronically on the Kobo platform and could also be analyzed electronically with no loss of time. Reports were prepared at the end of every day compared to a paper registration system that we usually use. The electronic registration of beneficiaries is the way to go. Information is readily available and can be easily updated and retrieved when needed. Data, data, data. The data is readily available. We know that we have an issue with data when it comes to policymakers. The village council clerks, who are the individuals paying monthly cash allowances to beneficiaries under the government public assistance program, were also trained to use technology when doing payments of the cash transfer grants. This ensured the digital reconciliation of the payments which were done. This assisted in the reduction of complaints by beneficiaries. Some of them were complaining that I didn't receive the money, I didn't receive the money. But when you went to the council's office with this digitalized reconciliation payment method, your picture was taken or you presented an ID, which also was uploaded onto the system. And so we ensured that there were less complaints. And this assisted in the timely reporting of payments by the village councils. Like my sister from Jamaica, we observed a number of challenges. Some members of the vulnerable groups do not have bank accounts. And so even if you wanted to send their money to the bank, they did not have bank account. The cost of doing business, the fees that are charged are usually humongous. And so these people who received a small stipend at the end of the month are not able to ensure that they have sufficient funds to ensure that their accounts are not closed at the banks. We have had discussions with the credit unions in Dominica because they have the M-Ledger, which can be uploaded onto their smartphones. But we also have the issue of some of our beneficiaries not having smartphones or being illiterate. Some of our beneficiaries are the people who are homeless, and so they're not able to ensure that payments are done utilizing these electronic methods. And hence the reason why some people really continue to have what we call cash in their hands. The COBA platform was also used by the audit department. That is the technology that we use to assist with matters pertaining to auditing of the records. We are currently in the process of working with the World Food Program and the World Bank to help create a management information system for all, or what you call a social registry for all social protection programs in Dominica. When that system is put in place, it will assist us with beneficiary registration and selection mechanisms, a unified registry, because in Dominica, we have approximately 30 or more different social programs run by the government of Dominica, assisting the most vulnerable. It will also assist us with payments, grievance and redressing, monitoring and evaluation, and we are hopeful that some operation manuals will be put together, including conditionally, if any, and referral protocols, and also exit strategies as necessary, because we do not want, if they are vulnerable persons who are on the system for a particular period of time, we have to have exit strategies for them. We are also working towards direct payment to accounts of beneficiaries, especially under our public assistance program that targets vulnerable families, disabled persons, elderly persons, children in need, and so on. We would like to send direct payment to their accounts for a better control and also for reduced costs, as well as to promote financial inclusion of our beneficiaries. Thank you.
Thank you very much, Mrs. Barton, and also very good points on both the advances and the challenges that you have faced. Thank you for sharing those, because it's really important for our learning today. And let's go to the last comment and question, and let's focus first on what we are seeing in the world. No? We're seeing in the world the number of hungry people increasing to 840 people. This is what we have heard in the SOFI 2021 is expected by 2030. And we have seen the huge economic fallout related to the COVID-19 risk and how it has exacerbated really the global and our region, the Caribbean, poverty and hunger. And how we have seen the poorest becoming poorer and the hungriest becoming hungrier because of many factors: job losses, the health problems, the sickness, the inability to deal with the compounding effects, basically, of COVID-19, and the other risk that came on top of it, as you all mentioned. So really a problematic situation that is also exacerbated by the actual crisis we're seeing in other parts of the world. So let me go back to the three of you, and let's start, if you are okay, Mrs. Robert Risden and Mrs. Barton, with Clemente Avila first. With this question, because what we are seeing with the rising food insecurity and the increasing levels of vulnerability that we are being faced by the small island development states in the Caribbean, what do you, World Bank and governments of Dominica and Jamaica, consider are the most critical investments to be made by governments to better allow its national social protection system to effectively meet the essential needs of the poor and vulnerable people that you have all mentioned in this time of crisis and in what is coming next? So thank you very much. And let's start with Mr. Clemente Avila. Over to you.
Thank you, Lola. So I think that while for different countries the critical investments may vary, we have identified some common general areas where we see action is most needed. We have structured this as 4 critical areas. So the first one would be to strengthen programs and delivery systems. No, this means closing coverage gaps where they exist, adjusting benefit size in particular, and this is very important to keep in mind now with food prices increasing, inflation going to levels not seen for the last few decades. No. But also in other things. No, so for instance, we want to see integrating risk and vulnerability analysis to the regular social protection system. We want to see capacity building activities for the staff to be able to deliver the benefits more effectively. No, that's the first area. The second area where we see there are critical actions that need to be taken are on data and information systems. No, so in many countries in the Caribbean, we see that there is a lack of regular collection of information on poverty. Although I'm glad to say that that some countries do their collection regularly. That is one thing. No, that information can be used, of course, to update the targeting mechanism, to incorporate risk analysis into the programs. But also, I think it has been mentioned very prominently by Jamaica and by Dominica that there is a need to move and invest basically on social information systems. No, so we need to expand social registry coverage, particularly in high poverty and high risk areas. We want to see social protection systems better linked to early warning systems. No, so this can help in responding to future emergencies. The third area where we see there are actions that could be taken is on improving basically the mechanisms to predict the cost of future shocks when that is possible. So, for instance, we know this is a region that is very prone to storms and hurricanes. No, so to be better able to have an idea of how much would that going to cost, and then put in place the layers of financial mechanisms that can help to cover this cost. No, so that might be reserves or contingency funds, but also have contingency credit lines, market-based risk transfer instruments, or made available other type of risk-sharing instruments that the social protection system can provide, like unemployment insurance. No? And lastly, and then this is very important, and the cost is not zero, but it is not the most the higher cost action, and it is to ensure that government is taking the leadership on the adaptive social protection agenda. No? And this is basically to ensure that there is policy coherence across the different sectors and cross-sector collaboration. No? We need that the champions on this agenda are governments and its people. No, the changes that are needed to make all these policy reforms and ensure that these policies are well designed and well implemented are of course our government counterparts. So I'm looking forward to hearing what the other panelists will have to say. Thank you so much.
Yeah, thank you very much. That gives us the broad macro picture, how you see it from the World Bank. I would like to invite Mrs. Barton first to give her thoughts on this and to close her comments with that. Thank you, Mrs. Barton, for your next comments.
Thank you, Lola. In a crisis situation, food security concerns revolve around food availability, food access, and utilization. This is one of the areas of concern to Dominica in times of crisis, not only for us as an island state, but also for the consumers of Dominican products, and we have first-hand experience in that area. We produce a lot of what we consume. However, depending on the crisis, food security will be of grave concern to us. And we have first-hand experience of after post-Hurricane Maria, with the destruction of all our produce, all our livestock, our houses destroyed. We saw ourselves in Dominica importing eggs, for example, for the first time in our lives to meet the needs of our population. Dominica does not only produce agricultural produce for our consumption, but we also produce and export to our neighboring countries. And so post-Hurricane Maria, our neighbors also had some difficulties in being able to access food, and it became a food security concern for them. Food security can be manifested in the following. Food insecurity can be manifested in the following ways. Local industries that rely on import and export struggle. Food supplies may be hard to get locally, and economic activities are disrupted, leading to loss of livelihoods, or social welfare benefits may be reduced. We understand this very, very clearly in Dominica, and so critical investments must be made by government in the agricultural sector, both for small, medium-sized, and large farmers. We must invest in more productive and resilient practices and modern technology to produce more food locally. We know that I come from an indigenous community, the only indigenous reservation in the entire Eastern Caribbean. And so we were accustomed of having resilient practices implemented on our farms. And hence, post-tropical systems or in times of crisis, we rely on our food supplies. And of course, we are very close to Mother Earth. Our water systems are kept intact. And so we're able to survive. Input support to farmers and agro-processors to preserve their productive capacity and to enhance food production. In Dominica, for example, during the fruit season, we have the fruit season where you have so many fruits. But after that season, then we struggle to have food produce to be able to make, for example, juices. And so we have to import. But if our people are able to get the required equipment and machinery, they will now be able to preserve as much production as possible for in times of disaster. Encourage households to grow fruits and vegetables to provide essential nutrients to all members of the family. We know that during crisis times, children are most affected. We must put in place mechanisms for food distribution and cash transfers. Governments must be prepared to purchase all the produce from farmers and redistribute through existing programs such as school feeding, hospital care, at the homes or institutions that take care of our seniors as a means of safeguarding production. We have the example that during COVID-19 pandemic, due to the lockdown, markets were not opened, although supermarkets were open, but the markets, the agricultural produce markets were closed. Government then put in place a system to purchase the agricultural produce from the farmers and redistribute that produce to families in and around, especially the city, who would normally depend on the agricultural market to get their produce. And also, government must collaborate with retailers to sell basic food items at controlled prices. I want to say thank you for having Dominica's example on this panel today. And I do look forward to our continued collaboration as we work towards proper social protection mechanisms being put in place for our communities across the Caribbean. Thank you.
Thank you very much, P.S. Barton. A pleasure. And let's continue with P.S. Robert Risden to give her thoughts on Jamaica, and then we'll...
Thank you, Lola. I am going to be very brief because my two able other panelists covered so much, and all of which are very, very relevant in terms of, critical investments that government should undertake to meet the needs of vulnerable populations. There's one thing, however, that I wanted to highlight, and this may be specific to Jamaica as well as it may be relevant to other countries within the region, and that is the need to implement a unique national identification systems. So we have found, for example, in all of the support, the programs that we have, that government has been able to roll out and implement, one of our greatest challenge is the need for a unique identification systems. I think because of how we have evolved as a society, you have persons with multiple forms of identification. And you know how it is in the Caribbean, P.S. Burton, people have multiple names and they may be registered under different names in different databases. And sometimes our programs, so the support to our small farmers, the support to our beneficiaries, are impacted by the fact that we do not have a unique identifier. So that is one of the things that I would consider as a critical investment that is needed for certainly for Jamaica and possibly other countries in the region. I mentioned the whole matter of the social registry. Clemente mentioned that earlier, that we need as well, so that we are able to identify where our people are, who they are, and so forth. And with that, I'm not going to go and I'm not going to repeat what some of my other panelists said, but just to endorse what they said and to thank you, Lola and World Food Program, for this opportunity to share on Jamaica's experience in the region. Thank you.
Thank you very much, P.S. Robert Risden. That was a pleasure as well for us. And colleagues, while we bring back Regis Chapman, let me try to attempt a very rapid conclusion, because I think our speakers have been so eloquent, so clear. We have heard so much about the Caribbean. what is happening and what else we can do together to have sustainable social protection and shock responsive systems on the ground that really are well funded led by governments, funded and supported technically and financially by both the UN World Food Programme and others, and the World Bank and other IFIs. That I don't have much to add here, but just to conclude, what we heard about the critical moment that the Caribbean has passed, not only with the climatic crisis, but as well with the COVID-19 crisis. And we heard how you managed to really enhance and increase and document as well the shock responses or adaptive safety net systems that you have put in place and how well they worked. You were also very honest to give us the challenges and how the challenges have also solutions. Which are the challenges that I've heard mostly? The registry, the targeting, the financial inclusion, the communication, and how we already have solutions that we are going to work together with both the IFIs and the WFP and the other UN agencies, but led by governments. And we hear that very strongly, how governments, you are in a position where you have seen what are the challenges and the solutions to enhance and have larger and more sustainable social protection system that they are also shock responsive and can be horizontally or vertically expanded when the moment requires. So really an extremely good panel. And I will say, what I've heard today from all of you is that we are all committed to leave no one behind, to ensure that the most vulnerable, the ones who really need us in the critical moments, in the compounding risk that are coming to our region, especially to the Caribbean islands, like Dominica and Jamaica, are really included, and we don't leave them behind, and we take care of the elder, of the one who have no financial literacy, of the ones who have no means of communication, and they will be included through these very good tools and innovative and digitalization that we are very clearly progressing together to put in place. And that we will ensure that there will be nobody affected by food insecurity that is affecting globally many more people, as we heard, that we have sustainable livelihoods and all that, and that we prevent as well that there is more people falling into poverty because we have good early warning systems and good systems that ensure the critical actions are taken early enough, so we know enough before, and we act on time, and we scale up on time our shock responsive systems in a manner that women, men, and children don't get affected and can recover faster from the shocks. We heard at the beginning, it took me very much, I took notes of, it took 1 year for Jamaica to get back electricity in 1988. These years, we should not take so long. We should take weeks for people to be able to go back in their feet and recover their livelihoods and be able to continue contributing to the development of the countries. So thank you very much. P.S. Robert Risden, P.S. Barton, Mr. Avila, Regis Chapman, colleagues. Really has been a pleasure to share with you this moment. And let's keep together working towards these goals that we have set today. Thank you very much again. Have a good day.
Thank you. Bye-bye.
Thank you.